Good afternoon. I am Amresh Tiwari, editor publisher of Double Helical, is one of the leading health magazine being published from Delhi NCR region. It's my kind privilege to host the today webinar on the topic of futuristic scope of robotic surgery. We have
For especially gynae, we have requested our colleague Dr. Pakhi Agarwal. Dr. Pakhi Agarwal is again a senior gynecologist with the Inprastha Apollo in New Delhi, and she has got more than 2 decade experience. After going through the entire experience, she also got involved into robotic intervention for last many years, and she has picked up this robotic intervention in gynae as she is very dedicated into this field. One thing more about Pakhi, I know that she is not only into the best possible intervention of gynae, but at the same time she believes in holistic approach. So I appreciate your approach towards the disease. Pakhi, can I request you to take over and give your experience in your field?
Yes, sir. Thank you, sir, for that kind introduction. There are two places where the robot has scored over conventional surgery, and I will highlight both of them, and both of which I am doing regularly. The first is patients of uterine cancer who generally tend to be overweight, they are obese, they are diabetic, they are hypertensive, they have a lot of comorbidities. And previously the surgery that used to be done was open surgery with a big scar going from xiphoid to the pubic symphysis. Lymphadenectomies were done very extensively, and that led to patients having a very long recovery time, and also lymphedema, which was a real problem, especially if the patients were obese. So robotic technology stepped in, and now for the last many years, the treatment for endometrial cancer has been standardized so much so that robotic surgery is now class 1 evidence superior, and in terms of patient recovery, and oncologically non-inferior to open surgery. So what I do regularly, and what we are doing at Inprastha Apollo as well, is we do sentinel node mapping for endometrial cancer, where we utilize the Firefly technology of the Da Vinci system, and we map the lymph nodes which are most likely to be involved with cancer. We remove them, we subject them to the oncological tests, and it gives us the information that we need. And performing surgeries for patients who have BMI. Most of my patients, they have BMIs over 40. Most of them are in the age group of over the age of 60 years, 60, 70, 80-year-olds. So you can understand that open surgery has a lot of challenges anesthetically, recovery-wise. For these patients, their reserves are low. And of course, many of them have had previous surgeries as well. So in this subset, in this population with endometrial cancer, robotic surgery scores far over open surgery, and definitely over laparoscopic surgery, which has a lot of limitations in obese patients. So that is one. And because their recovery is so fast, if they have to go on to the next stage of their treatment, which is maybe radiation or chemotherapy, they are able to start that without any of the complications, say of wound breakdown, burst abdomen, and sepsis, and all of those which are common in this subset of patients. The second place where robotics has a lot of role in gynecology now is fertility preservation. So women who have fibroids and multiple fibroids, we used to say at one time when we were training that if a lady has more than 3 fibroids and the cumulative size of the fibroids is more than 15, they should be going in for open surgery. Even laparoscopic surgery is a big ask. I myself have done many more than that even in a patient. So the volumes we have removed, we've even published that data. So robotic surgery allows us to do that, to work very precisely, to separate the fibroid from the uterus, to preserve the myometrium, to reconstruct the myometrium, which is very important because here we are looking at a uterus which is not just structure, also functional. So to preserve functionality of the uterus, removing all the fibroids, robotic technology allows us to do that. There is a lot of precision, lot of magnification. Most of these patients don't even require blood. because of how precisely the surgery is done. And I thank Dr. Malhotra for highlighting all the nuances of how the robot is better than conventional surgery, makes it easier for me to explain. So we hardly have any blood loss. Patients are up and about the same evening. They are allowed. So we have an enhanced recovery program that we follow at Apollo, and they start ambulating the same day. They are orally allowed the same day. Second, third day, they are usually going home. This is across the board, whether they are young, they are old, they have comorbidities, or they don't have comorbidities. So fertility preservation there. Fertility preservation when it comes to large ovarian tumors as well. Also, so separating the normal ovary from the diseased ovary, separating it out, and again with oncological principles in mind, conducting that surgery. So in the space of gynecology, I think amongst all the other specialities, robot has made a big dent in the landscape. A lot of women are now aware of it. They're asking for it. And because we see the difference in outcomes. And the other thing that some of my other colleagues might have highlighted, when we go into the abdomen and we feel gas, of course, it's not the same for cardiac or ENT. So when we go into the abdomen and we feel gas and we are moving instruments all around, one of the typical problems patients have, for example, after laparoscopy, is they have a lot of port site pain. So wherever we have gone in, we have made those incisions, they have pain at those sites. In robotics, because the technology uses a lot of very complicated physics and a lot of things go at the back of it, these ports are nearly almost always painless. So even if you have done the surgery, filled the tummy with a lot of gas, done the surgery, removed the gas, removed the ports, these patients after the surgery sometimes even ask, did I really have the surgery? Because I feel I have no pain. In my mind, I thought I have an endometrial cancer. I'm looking at an 8-hour surgery with a long recovery time, and here I am next day in the ward walking about, eating, and now you are telling me to go home. So sometimes the Indian mindset is such that if we have cancer, we are in the hospital for 10 days. That is changing now. So, and we are able to offer that because we have the precision, we have the magnification, we have the skills to do that. So those are two places I feel, sir, in gynecology and oncology where robotics has made a phenomenal difference. Sir, you're muted, sir.
Thank you, Paki, for highlighting the role of robotic intervention in gynae, onco, and in the other important fields like fertility and all. Can I ask you one question? Do you think futuristically, or it has already come, any role of robotic intervention in obstetrics?
So I think probably it will never come, because we do need to give that 10 centimeter incision to deliver the head. So while we are talking about less than a centimeter incisions, that is probably the only the space in obs gynae where robot will not supersede traditional obstetricians. Probably the only space, but everywhere else, complicated hysterectomies.
Believe me, as a routine delivery, I will never want robot to come. But in certain conditions where perhaps our obstetrician colleague do find some problem, there can be some solution.
So there is a role for the robot here. Say women who are pregnant and they have an ovarian cyst, which does happen in pregnancy, and they need that cyst to be removed. That part can definitely be tackled robotically, because we need very limited space to go in when we go in with the robot.
That's good. So overall, you agree that though the cost is more, obviously, and at the same time we did discuss that as the time is passing by and we are trying to look into more innovative robotic versions of previous ones and make in India product. As I said before, that will bring down the cost, as well as now I strongly feel, all my colleagues in front of me agree, it is not only you are recommending, of course you are recommending, but the patient is also perhaps strongly demanding, because the patients are very well read and they are demanding. But at the same time, if they are demanding and you also agree with them, then it becomes a double feature. Then you have to do. Your experience, Dr. Rajneesh, the patient is coming to you.
Yes, sir. Patients do ask for us. I mean, they come and they always ask me for robotic surgery. They always want their valve procedures, their bypass operations, and their ASDs and all these things to be done robotically. So patients really ask for it.
Kalpana, what is your experience that the patients are demanding now? Kalpana, unmute yourself. Unmute yourself, Kalpana.
Sorry. Yeah. I feel a lot of awareness is required, sir, but now, just yesterday I operated on a pulmonologist who has sleep apnea. And there were some doctors from Malaysia, 2 doctors whom I operated. So slowly the awareness is increasing and people are able to understand it's really giving benefits. So hopefully we can do in large numbers. Yes, consumables cost is still a challenge. Hopefully that comes down and hopefully we can do large numbers. But yes, slowly the graph is rising.
Great. So we had wonderful discussion before I hand it over. Because we had discussion in the field of gynae, in the ENT, cardiothoracic, and orthopedic. Of course, there are other areas also. I would request Tiwari to discuss those areas also, especially urology and all. And we had a wonderful discussion. There may be few questions. For I and from my side, let me say my thanks to Mr. Amrish Tiwari, my friend, who started this double helical magazine 10 years now. It is going to be 10 years, and this magazine is really coming up as a very important piece of information for medical specialists like us, as well as for the public and everybody in society. I wish all the best to
Thank you, sir.
Helical, and over to you for question answers, Tiwari.
Yes,
My sincere thanks to all my friends,
okay.
colleagues for joining me.
This question goes to Dr. Paki Agarwal. It's related to your field. Could you tell us this question from Minali Joshi from Maharashtra and Pune. Can robotic surgery help in complex gynecological procedure like endometriosis treatment and fibroid removal?
Yes, sir. So endometriosis, in fact, there have been now trials to say that it is even superior to laparoscopy. So endometriosis, again, you need magnification to pick out the smallest spots. Fertility, because most of these women who have endometriosis are infertile. So you need to preserve fertility. So endometriosis, definite yes. Robotics is far superior to even laparoscopy. Fibroids, as I outlined in what I spoke, when it comes to fertility preservation, especially in multiple complicated locations of fibroids at odd places, all of that robotics scores over conventional surgery. So yes, in both of these, as well as in complex hysterectomy. So any gynecological surgery per se, the robot has a very, very good role.
Thank you very much. Sir, this question goes to Dr. Rajnish Mittal. Sir, could you tell me, this question from Neha Verma from Calcutta. Many patients worry about the reliability of remote robotic procedures. How would you comment and ensure patient safety during a robotic surgery?
So remote surgeries have just been started. As we had just discussed, that remote surgery, but the surgeon has to be at the bedside, as well as the expert surgeon has to be by the side of the robot. So both the places surgeons have to be there. I can understand the complexities there, but one has to be, both the surgeons have to be really expert, and it can be done. And as I said, very recently we did a cardiac surgery from Gurgaon to Jaipur. So, but both the places the cardiac surgeons were there. One cardiac surgeon was performing surgery in Gurgaon. The other surgeon was there at Jaipur, and it could be done. Because if the surgeons are expert at both the ends, I think there should not be any problem whatsoever. And it is the future. It can, because the many surgeries you can proctor that. A surgeon can be proctored, or if there any problem, expert can really always come into picture and they can tell about it. So this is a practicality, and this is the future.
Sir, as you know that with AI advancing rapidly, do you foresee a future where robotic surgery are performed without human surgeons?
I don't think so it will ever be possible because the clinical decisions have to be taken. So clinical decisions where to cut, where not to cut, AI cannot take a decision. So it has to be a surgeon, it has to be a trained person because at the end of the day we are treating human beings, we are not fixing machine. So you have once you are treating human beings because every human being is different. Although I may be doing bypass surgery every day, but all surgeries, all hearts, all coronary arteries are different. So I mean, the clinical decision is how you are going to operate, what decision you have to take. And I mean, I don't think AI is going to take over that, but AI can help us in giving, I mean, a pre-planned thing that okay, this is how we can, I mean, see a tumor. This is the thing what we can pre-plan the entire procedure beforehand, and AI can always guide us. They can give us all the investigations and all while you are operating. This is also already been done, but I don't think AI will take over entirely and a robot will perform the entire surgery. Not in near future, I think.
Sir, this is my last conversation with you regarding this robotic surgery. As Dr. S. Gulati told us that most of the insurance companies do not cover the robotic surgery. So, as a policy, as you already vice chairperson, chairman of the Upper Max Group of Hospitals. So, and Dr. Agarwal also, you tell me that as a policy level, what you people doing your level based to most of the insurance company cover this robotic surgery in the worldwide, is a nationwide.
So we as our hospital has represented and gone to many insurance companies and our healthcare providers as well as the government so that they can consider robotic surgery nowadays is not a cosmetic surgery because insurance companies think that it's a cosmetic surgery. That's why people have to spend more and it's not a cosmetic surgery. It is something for the benefit of the patient because the patient can go back to their work and have less pain and perform their day-to-day procedure and they will be more useful to the society.
It is.
We are representing to the many companies and hopefully I think they have started covering it partially. Few companies cover it 50%, few companies and the insurance regulators we have approached from our Max Health Group because we have got large number of robotic installations in our institutions. So they are considering it and we are hopeful that they will be considering it as a part of the regular surgery, not as a cosmetic surgery, not as a luxury.
Thanks a lot, sir. And I am very grateful to join our webinar, the very hot topic, futuristic scope of robotic surgery. Dr. Agarwal, hand over to you, please conclude this.
I think we have already done so. So we had a wonderful discussion, all my friends, colleagues, and this is the topic which cannot be discussed in 1 hour.
Next time we will keep the
only other specialities, but at the same time there are more specific detail of robotic surgery. So please, this is part 1 and you should keep part 2. Like nowadays you are looking into serial and part 2 serial, part 3 serial.
yes.
तो आप इसका भी कम से कम 2-3 पार्ट और करके
definitely
cover up the whole robotic intervention.
मैं तहे दिल से शुक्रिया करूंगा आपने एज ए मॉडरेटर वेबिनार को बड़े टैक्टफुली इसको कंक्लूड किया एंड आई रियली appreciate the effort of Dr. Rajneesh Mittal, Dr. Pakhi Agarwal, Dr. Kalpana Nagpal, Dr. S. Gulati. Thanks a lot. Very, very shukriya.
Bye for now.
Namaskar to all.
Thank you, sir. Thank you very much. Thanks for this opportunity.
Thank you, sir.